Hey everyone, second time around. Hopefully my sound is working now. Please let me know. Today we are doing an Instagram live regarding optimal health starts in your mouth. And we're joined by Dr. Dom, my good friend from Germany. Please let me know where you're joining us from around the world. Cool, the audio is working, amazing. So please let me know where you're calling from. Hey Sarah. And also, if you do have questions, if you put them in the comments as well, I'll try to get those questions answered as well. But we'll try and keep it for about 20-minute, 30-minute conversation. Okay? So here. Hey.
What's up, Wolf?
What's up? How are you doing?
I'm very good, and you?
I'm amazing. Amazing. How was your day today?
It was good, just coming out of surgery.
Cool.
Straight into the live, man.
Yeah, awesome. Thank you. Well, thank you again for joining us. It's obviously off the back of the posts that we shared yesterday, or that I shared yesterday, talking about oral health or dentistry and how essentially optimal health starts in the mouth. So again, before we get into that, do you want to just give everyone, I think you'll do a better intro than I can. Obviously I'll just start with, you're one of the world's leading biological dentists and surgeons when it comes to the mouth. And again, you're an author of the book, Health Starts in Your Mouth as well. So again, do you want to just give a little bit more of an intro on top of that as well? Tell everyone a little bit more about you.
Thanks, Ryan. It was actually already great. Yeah. Specialist in biological dentistry, but also obviously interested in overall health and international leader in that field of ceramic implantology, the current vice president there. So my goal is actually to show people that optimal health starts in your mouth, and we're living currently in an epidemic of chronic disease, and this is the most underrated part of the body, unfortunately, or the most overlooked. And this is my mission, to spread this with as many people as possible to end suffering, so to speak, and obviously aligning with wolves like you, bro. And yeah, so I'm doing this for more than 15 years. I'm also a naturopathic doctor, health expert, just overall interested health enthusiast, I would say. And we start or believe that optimal health starts in the mouth, basically.
And again, it's kind of interesting how there's a differentiation between doctors of the body and then dentistry. And again, being how the mouth is in the body, you would think that doctors A would know about the mouth, but then B, how dentists should know about the body because it sits in the mouth. So again, there's two sort of disconnects here, and essentially what you've done is joins, and actually should be what either a doctor should know or a dentist should know about the whole system and how it's pretty much all connected.
Yeah, you said right. It's pretty much, biological dentistry pretty much tells you that the mouth is part of your body. And actually it is the entrance. And the problem with conventional dentistry, or where there's a few, let's say, knowledge gaps that we need to be filled, because it's more about repair. That's what you learn in universities. Like, teeth are these tiny little biting instruments. Yeah, they're hard, but you can bite on them, you can repair them because they are not basically alive. And this is how we are working on it. It's pain treatment, it's biting, and it's maybe aesthetics. That's conventional dentistry.
Yeah, and again, I think going with the aesthetics that's pretty much where people mostly start with their health. Is, okay, cool, I've gained weight, I need to go to gym, I need to eat better, I need to exercise more. Or, oh, I've got a crack in my tooth, I bit on something, or something's fallen out, plaster it up, tell me what to do. They're not actually going to the root cause, essentially, pun intended, of like why this occurred. Why is there like brittle or fragile teeth? Why are they gaining weight at like crazy rates? So again, like I mean, the first question is like, what do you feel, being like in the field, on the front line, do most people do wrong with their health or looking after their teeth?
Yeah, it actually boils down to what you always talk about, because health and overall health, you can see it on your teeth. Teeth naturally are hard as stone. They're designed beautifully. They're actually as hard as granite. But because we became weak over time and quite convenient and started to eat softer foods and nutrient depleted foods and actually stopped chewing so much in comparison to our ancestors, let's say 10,000 years ago, our teeth get weak and weaker over time. And this is when whole dental repair actually begins. It's a lifestyle issue. And you have to see, chronic disease is the epidemic, and the number one chronic disease worldwide with over 90% is tooth decay. And this is totally preventable. Actually, in my opinion, in the future, we shouldn't need dentists at all that repair teeth. There should be an overall health doctor that also looks into your mouth. And this is like what you say. Dentists repair teeth, but are not really focusing on optimal overall health. Whereas doctors rely on their dentists to tell them, okay, there's everything fine in the mouth. And they're not taught about other problems from the mouth besides the let's say the conventional dental diseases like tooth decay, gingivitis, and periodontitis. So they don't even look further, because the WHO last year said chronic disease starts in the mouth is 70%, but they only look for tooth decay, gingivitis, and periodontitis. They don't look for the stuff that the dentist has placed in there to repair, which is a big epigenetic stressor.
Yeah. I mean, again, obviously there's so much context there, but what ages do you see this like declining? Or is it really like from birth, going back down to the mother's health? Where does this all begin, essentially?
Essentially, it begins in the womb, but definitely it begins with breastfeeding. So the whole jaw development starts already when you suck on a nipple or on your breast. It all grows better. And obviously the nutrients are at the beginning when you're in the womb, they come from the mom to the baby through the placenta. And the teeth are actually developed, I think, very early in the womb already. And the second teeth are also very early developed. So it's all about the steady supply of the right nutrients from conceiving, actually, but at least from giving a breast milk to then the right lifestyle and nutrition, like Weston Price showed it.
Yeah.
More than 100 years ago.
Is there like genetic factors? Someone just asked this question. Is there genetic factors? For example, my mum would have like maybe fillings. She'd have like crooked teeth. Would that have an effect on my teeth per se?
Yes, a little bit. There is genetic things that you can transfer, like, and they maybe can jump 1 or 2 generations. For example, I had crooked teeth too, and my mom didn't have it. So I had it because of wrong diet, and I'm not sure if I can make it for my kids, but certainly, and there is maybe, like you said it in the post, genetics load the gun, epigenetics pull the trigger. Same applies here. There are a few people that are a little bit more prone to tooth decay, and the research is quite clear. It has to do with celiac disease, or gluten intolerance, and leaky gut, and obviously problems with mineral absorption. But also the second one is always vitamin D3 deficiency. We're just not going outside, or in my world, or like where you're originally from, UK, or me in Germany, 6 months of the year, there is no sunlight. So you're really lacking key nutrients for bone and teeth development.
Yeah. I mean, when you're talking about tooth decay, what are the first signs that people need to be aware of to even know that there's something? Obviously, there's toothache, there's sensitivities with cold or hot liquids. But like, what would be the telltale signs of someone to like, okay, cool, there's maybe something going on here. Bad breath would be another one. What advice would you give people about the warning signs, essentially, before it can get worse, essentially, and they don't operate, they're not on your operating table, basically?
So usually the initial tooth decay, you don't really see. This is something that a dentist usually diagnoses as initial cavities. Normally it's in between the teeth. It's called interdental cavities or initial decay. And for a biological dentist, this would be a sign of a nutrient depletion, mainly minerals. And you understand the biochemistry around it. This is hard to see for yourself. Obviously, when your teeth get sensitive, it's already maybe the next step already, that you're missing key nutrients and key mineralization, which comes from the inside of the tooth, blood supply, but also always from the outside, saliva. So it's two strategies where the tooth gets remineralized all the time.
Yeah, it's interesting with the saliva, because obviously that touches on like the mouthwash. destroying certain bacteria, but also, yeah, well, that's the main one, and altering the pH essentially. And obviously I throw in there like mouth breathing, which would have a change in the oxygen tension around that tissue as well.
So mouth breathing is, generally speaking, it's an adaptation of your body, because everything is inflamed and mostly swollen, let's say tissues in your nose, tissues in your throat. That comes down again to epigenetics and most likely sort of immune reactions too. For example, personally, for cow's milk and dairy is a big one here. And then you cannot get air, and then you just adopt a mouth breathing pattern, which is actually more normal than unnormal in the Western world.
Yeah.
Even though it's really bad for your health.
Yeah. It's just a fallback system essentially, where your body can't use its nose effectively, and then you're like gasping for air essentially. I mean,
of course,
some other tips would be like, how would you go about finding a good dentist or hygienist? What do people need to ask or look for?
I would probably look for the label of holistic or biological dentist in the first place, which doesn't mean that they are better or not, because you always have to see if they're manually skilled. But this is what I would do first. So are they still using metals? That would be a total no-go. Are they big on fluoride or chemical mouthwashes, which is the classic dentist actually? Big no-go, where you could already see, maybe that doesn't resonate with my goal, which is optimal health. And therefore you have to find people that think a little bit outside of the box. But in the US, there are a few bodies, let's say the IAOMT would be one, where you could find dentists that are certified at least to remove metals safely, and they're thinking outside the box. There's the IABDM, the biological dentistry medicine. In Germany, we have the ISMI, where I'm the vice president. So we are working on it, but it's still the most biological dentists, even the ones that I have trained, they're still mostly focusing on biocompatible restoration, which is important. So they know how to remove root canals and metals and the cavitations, but they're not really trained yet in, let's say, nutrition and all these lifestyle factors. But there are a couple of them. So you just have to be aware of what to ask. And also,
do you think the directory on Ask the Dentist, I've forgotten what his name is. Have you looked at that resource where you can put in your postcode and he's got listings of biological dentists per se?
I'm not sure if Ask the Dentist is a full biological dentist. He's more like a functional dentist, but I think it's kind of overlapping. So I would go with these strategies for sure, because he definitely thinks outside the box. But at the end, for all you guys out there, it's always about your inner feelings. So this is just a caveat from my side, because I have the issue that there's many people out there now, if you get a bit more known and the thing gets a little bit more rolling, there are people and dentists that ride on that wave and tell you they're trained by this or this person when they even don't. And then they get then biological dentistry again gets a bad rep, which is really coming in for this, which is really sad. So gut feeling, if I dropped out right now, the gut feeling is the most critical thing. Test it, look for it, but then do you feel good with this practitioners?
Yeah. Okay, so what would be, like, back to you, what is your ideal dental strategy or routine? For
me personally?
Yeah.
You mean when it comes to hygiene?
So looking after your teeth. Just looking after yourself.
Yeah, looking after myself, obviously the number one is your lifestyle and nutrition. But when it just comes to the oral hygiene part, brushing with let's say a toothpaste that is as natural as possible. So definitely go fluoride free, definitely go chemical free if any way is possible. It's like SLS, titanium dioxide, all these things, but you find those in posts from us. Number one, like chemical free, I'll explain in a second. Number two, instead of the mouthwashes, the chemical ones, you use coconut oil pulling. You and me, we have a post about it, and I think it's in the one from yesterday too. So coconut oil pulling is a classic ancient Ayurvedic strategy that does even the same thing, but even better, because it doesn't kill off your good bacteria. It helps the good bacteria, but cleans out the bad ones. It also helps with detoxification. It's antiviral. So that's really, really good for you and also for the teeth. And number three is always the tongue scraping is a good strategy. Again, Ayurvedic strategy. Preferably you use a copper tongue scraper, because through the night there will be a lot of food debris and bacteria that kind of accumulate at the bottom of your tongue. And this is also cause of bad breath sometimes, but also of immune issues. So just using a tongue scraper, which is a thing of like 15 seconds, is an amazing strategy that you could just start doing.
Yeah, I mean, with your clients and just your experience, like how often do you see the people on your like in your surgery with mouth issues and gut issues? How often is that?
This is 100%. I always say the gut starts in the mouth. It makes sense because this is a tube. It starts here and it ends there. And obviously the whole immune system, the whole digestion already starts in the mouth. Think about preparing your food. What happens? Your saliva starts to flow. You kind of like get, I don't know if there's a saying in English, but it's mouth watering is what we would say in Germany.
Yeah.
So your body gets prepared, activating the parasympathetic nervous system, and enzymes get produced and peptides that help with digestion. Also, there's a whole immune system. So if you have any sort of metals, root canals, or other health killers in the mouth, 100% guaranteed you have a dysbiosis in the mouth and in the gut, because you basically swallow your microbiome on a daily basis.
Yeah.
It's a lot of liquid that you swallow per day.
Regarding like braces that maybe people get in younger life, what is there any knock-on effects with the metals that they have and consequences of that?
I would say with braces, this is more like in that phase when you're having the braces, because braces are mostly metals. The problem is with metals is always 3 challenges. It could be toxic for your body. I think with the metal braces is not that bad. It's more an immunological problem because they all contain a little bit of nickel. And you know, nickel is a very high allergen.
Yeah.
Yeah. And third, in this world, like when I had braces, I was a little kid in the 90s. There was no cell phones. There was no Wi-Fi, no 3G, no 4G. Nowadays, you install a metal antenna in the middle of your nervous system. So this definitely will interfere with the kid in his growth during puberty. So if I had a kid at that age, I would go with a liner, which is basically a plastic splint, a hard plastic splint, which is definitely way healthier if you need braces.
Does that fall under the Invisalign?
Yeah,
Invisalign
I would say Invisalign is the first aligner that get the best, like the number 1 label probably still out there. So Invisalign is always good. Okay. It's obviously probably not covered by your insurance. So, but if it's me, if it would be me, I would invest in it, because I wouldn't want to have my kid in this world right now having an antenna. I've seen so many. It really can alter your kids' psychology too, like make them, let's say, more shy or change their growth hormones. There's crazy things that happen.
Yeah, there's some interesting studies looking at, although it's not like gold standard, hair mineral analysis testing, and then obviously seeing this in like autistic children or ADHD. There's a massive correlation, and obviously it depends on like your detoxification capacity of removing these metals, what else is going on in your body, blah blah blah. Especially for kids at this early age, depending on their like breastfed, the birth, all these kind of epigenetic factors. It's really interesting to see. I mean, if you are, say, like middle-aged, you got maybe 2 or 3 amalgams in your mouth, and obviously they do erode over time. So actually the metals do leach out. What would be your point of call? Like, what would you be suggesting to these people? Would you always be like, get it out if you can, or just leave it? It might be more troublesome to get rid of it. Where would you stand with this?
So everyone that comes to see us gets a full treatment plan, which is always metal, no more metal, no root canals, no cavitations. But there's a big caveat again. If you listen to us, amalgam is 50% mercury. The silver fillings are not really silver. They're 50% mercury. That's the most toxic non-radioactive element known to man. That being said, it is highly, highly critical that you don't go to a conventional dentist and just tell them, I want to have the amalgam out of my mouth, because they will just drill it out, not knowing that this will cause more problems. So you really need to find a dentist, a biological dentist, and better one that is trained to especially safely remove these amalgams. Because otherwise, I would rather leave it in there and search for somebody worldwide.
Yeah, and regarding
that's really dangerous.
That's
otherwise.
key. Yeah, I mean that initial exposure and the release in the air, and that's obviously why you actually. I don't know if you actually should put a picture of you in your clinic, but like you are top to toe covered, air extractions, the whole lot. No Wi-Fi zone in your clinic as well, which is amazing. Which is what Tim told me about. Like the best, nothing, the gold standard. But if someone's got a root canal as well, again, how do you know if it's technically like there's dead bacteria or there's bacteria there? How do you know if there's really a problem to investigate?
It's pretty simple. My goal is optimal health, and yours too, I know. So I always look for things that are unnatural to the body. And obviously you're not born with a root canal. A root canal is it's a standard conventional treatment to basically get you out of pain and keep that shell of a tooth for biting. There's enough studies to show that over time that this tooth, which has no more immune system after the root canal treatment, is now the perfect cave for the bacteria that live with you in your mouth anyways. But now they can compartmentalize in these root canals and produce their metabolites, which are again very, very toxic, but also immunological active. It can be, and this is an issue here. Obviously, our bodies are amazing in adapting and compensating, but we are living in chronic disease. And if you already have an issue, or if you try to optimize your body and do everything already, but you're still not superhuman, then I would say a root canal might be the splinter holding you back, the root cause that needs to go out, because it's in your nervous system. It's on the trigeminal nerve. It is the trigger. It's not like you have a chronic inflammation on your arm that you would see every day and you're like, your doctor, okay, we have to take care of this. No, your arm is not important for your body. It is in your mouth, and your mouth is like your eyes, an extension of your brain that starts here in the brainstem. And these toxins will be transported and on a daily basis. So for me, it's an absolute no-go. It's the most controversial topic in dental world anyways, but
I mean, on an ancestral level, like obviously maybe someone lost their tooth, maybe one of them like rotted and maybe it just fell out. So again, what would happen naturally is it would just basically the immune system would just, again, the tissue would just mold over essentially and sort itself out. Now, I mean, what would you add to that? How would that have worked, or what would be the principle behind it?
Yeah, it's totally. Like you say, in a natural world, you just get an inflammation and your body will loosen up with collagenases. It basically produces a local inflammation. And then the tooth is not, it's not like in concrete cemented. It's hanging in there. So the structure around the tooth will just kind of like dilute through the collagenases, and the acute inflammation, you have massive pain, and it just basically passes out. Body just extracts it by themselves. It just gets loose and red and it's painful. That's just normal. But as a dentist, obviously, we can have tools to reduce the local inflammation, to get rid of the bacteria, to get rid of the immune system and make it stable again, so that you're out of your pain, but also on a subclinical level can tolerate this tooth, which is fine. It's a very highly skilled technique. But I would say, and when it comes to optimal health, not just surviving or just living, it is a trigger to your immune system. It's a trigger to your detoxification system. It's just one of the main health killers that nobody of you out there is even aware of. And luckily we have solutions for it. So we plan always, we remove all root canals because patients come for this, obviously. And we remove it, but very, very gently. There is no ripping off. And this is important that you understand this. We remove it, we clean it with ozone, we use PRP and everything. And then if it's clean, we very minimal invasively insert a ceramic implant to hold the structure. And here comes the kicker. I had one patient yesterday from a friend of us together. She was actually referred to me 3 years ago, but she couldn't travel to me. She had my planning. And because of COVID, she thought, okay, I will find a biological dentist in the US. Fuck, I've seen the experience she had and her husband. They hate biological dentists now. Basically, they ripped out everything. It's totally destroyed now. I would never be able to now place an implant. And the other way around, would have just been, okay, now is the time for the strategy to remove this root canal. We try to optimize everything, still not 100% healthy. Let's work on this part. Find somebody who is able to take that out very carefully, because the tooth is anyways dead. And then use that socket to place something, because your body anyways wants to heal. Not a titanium implant, because it's metal again, a ceramic implant. And this is the future of it. Obviously, the future will be that you don't lose your tooth in the first place.
In the first place, yeah.
Because you listen to Ryan and what he says about nutrition, and then you have teeth hard as stone. Yeah.
So ceramic is just, in your view, from what you know and your experiences, is like non-negotiable. It has to be ceramic.
It has to be if you really want to. So otherwise, if you can't go with a ceramic implant, then leave the dead tooth, because a titanium implant comes with the same immunological problems, plus has also the antenna effect and your immune system. So a titanium implant is not a solution.
So you would actually say to some people, if they don't have the finances to get the ceramic, of just like leaving that dead tooth in there, maybe find some strategies of optimization and other things.
Yes.
Because again, your body can actually combat the dead tooth more so than a rotten, not rotten, but bacteria, which the body can't really get anything to, and cause more problems with the antenna effect. And
yes. So
yeah.
For this, I have designed an online course, which is basically the whole overall concept, where you learn about all the oral health killers and what to do. But also it always starts with optimizing your health, with nutrition, with nutrients, just to help your body compensate. Because I also don't want to see you straight away. I would prepare you for surgery too, so that you heal. So definitely do everything you can.
Yeah.
And yes, better leave the tooth before you do anything crazy.
Okay, like this is a little knowledge bomb right now. It's like, if I actually had to have tooth surgery or any surgery whatsoever on my body, I would do it in the summer without a shadow of doubt. Late spring to summer, if I was in like the northern hemisphere, and the table would be turned if I was in the southern hemisphere. Why? The sunlight effect, the vitamin D, the pain reduction from sunlight. It's a game changer. And again, I'm going to like the question next. Have you seen better responses with surgery with clients coming in the summertime opposed to people in the wintertime?
Yes, for sure. If you don't optimize, obviously we cannot only do surgeries in summertime, because then it would be very, very limited. But because we use everything and prepare patients, they are always prepared as if it would be summertime. So they are not, like you say, they're not in hibernation mode, but they're in like fully healing effect. Otherwise, and most people are actually, even if they live in Costa Rica or Nicaragua, they're still in hibernation mode, because they don't go out in the sun. Yeah. That's why I have patients coming in from all over the world, sometimes even Africa, Costa Rica, and they have a vitamin D3 level of below 30 nanograms, sometimes even 20. And it's crazy. I cannot go in the sun now. There is no sun. But they could, and they don't do it. Same in Dubai, same, you know it. It's like everywhere. They just don't understand.
Okay. So I'm going to be some short questions next, but the last question would be, like, there's obviously a financial investment involved within your mouth, within like any health, whether it's like working with me, whether it's like getting a test, supplement here, there. How can people really, obviously don't get in that position in the first place, but how can people like who might not be able to invest in the procedures, the removal, what do you do in this case? What would you give advice to someone who hasn't got like the financial capacity to make these changes right now?
Right now, you might not need to. You can really just start with the basics, so that you try to optimize your body in every level with the free things first, but then obviously your nutrition. But I would really say save up on it for a near future, because this is really something that might be holding you back. And the question is always, what does it cost you in the long run when it comes to health to keep that stuff in you that is really not toxic? And this is really a thing, because I have patients from not really having a lot of money to really wealthy. And I have no problem with money or any issue with it. For me, it's just the transfer of things. But I remember 20 years ago or 15 years ago, my dad would always say, this person cannot afford it, and this one. And I'm like, how do you know this, man? Like, why do you know that he cannot afford it? And I can find, and I tell you from experience with thousands of patients, it is only up to your priority. Both levels. There's patients that have money without an end. They don't see it as a priority. And the other way around, they have like, they save up for it. Some people even sell a car, fly in from all over the world. So I work a lot with Dietrich Klinghardt and over the last years, and he would be very strict with his patients, with his chronic sick patients, Lyme patients, for example. He would sometimes even tell them, hey, sell your car. You cannot get healthy unless you not do invest. So it comes down to priority, but I would always say start with the 80%. And if you then still not superhuman, save up on it, and then please find somebody who's really skilled. And I'm there to teach people and dentists for the next 10 years, because we need an armada of them, because for now there's repair to be done, hopefully not for our kids' generation, but for our parents. Look at your parents, dude. If you see their mouth, it's insane what they can compensate.
Yeah, I try not to. I mean, I try not to try not to go there, but like with just lost the train of thought. So okay, this was the question. Like, not to like poo-poo the biological dentistry industry. Like, again, even in my space as a nutritionist, there's people who I would personally feel that they are there to profit off patients. How would you, like, as maybe putting yourself in a patient's shoes now, how would you assess them with this treatment plan, with what they're outlining? Like, how would you, like, either question them, know what they're talking about? How would you get a fair assessment of, this is what I really need and I can trust this person?
That's a really good question. This is why I have this online course now, because with the information in the online course, you will know more than most dentists, because it's the course that I use for onboarding my dentists and my nurses. And you will know exactly which questions to ask the dentist. And if he cannot answer, he's probably not the level you look for.
Yeah, because again, it's like really interesting. Like, some people walk blindly into the dentist's chair or the doctor's office. They're the expert, these people with these titles. And then people are just scared to say anything, or why do you want me to take this pill? Or why are you doing this extraction? Because there's a real like power contrast here. And again, it's just like, people just need to be asking, okay, why are you doing this? What's the process of it? Not just be like take my teeth out or put this in. It's like your body. It's like you still have like right to it.
Yeah, I think this is a generational shift. So like my grandparents or even my parents would probably still be the doctor knows best approach.
Yeah,
but I would say at least us are already a little bit, we like super aware. But I think the generations after us actually, I don't know, what is it? What is it? Whatever. Like you and me, we are TikTok. Yeah, TikTok gen. They are more like who's the best in the world, and they're really like they actually are. They know best, and then now they challenge the doctors, which is good and bad, because sometimes they think they know too much and they forget that the doctor might have 20 years of experience with thousands of patients, not just with themselves, and has read about methylation too. So it's a double-edged sword, but definitely this is why I think it's so important that we are all empowering our patients out there and teaching. Therefore I wrote the book, therefore we speak on stages, therefore there's the online course now already, because I basically just want to give as much information as possible, because it's not about me or you, it's about changing and help people to become optimal healthy, because it's just more fun.
So you have young kids as well. Like, what's your strategy? How does it differ between kids and their age as they get older? Is there any like tips and guidance you can give parents out there to help their kids, or if they need to do anything different?
Yeah, so definitely, so 100%. So you should treat your kids as yourself, as little humans that grow up, and they definitely need the right building blocks for their life. And just saying, oh, they're little kids, they should eat the kids menu. No, you have to be a little bit, like, let's say you have to be educated as parents, and then also at times a bit strict. That's me. So obviously Steffi breastfed all my boys for 1.5 years, Louis even 2.5 years. And then at home, we try to eat as natural as possible. Obviously, it's again like a fine balance, because I also don't want to make them too freaks. Obviously, they can eat their ice cream and they can have their cake too.
Yeah.
But I teach them. I teach them to become. They want to be superheroes.
Yeah.
So they know if you ask them, they will always choose the good stuff first, and then they know they can have a sweet as a treat maybe. But they are not like, they have never been to McDonald's. They don't know what fast food is. But obviously they know gummy bears, they know ice cream, they know chocolates. It's no problem. It just have to be an 80-20 approach would be ideal. And this is something me and also Steffi, my wife, we teach on a bigger level, that healthy living with kids, it's the same thing as we do. Like, they're just tiny humans. They need the right things.
But would you
and
say
just because we ate shit when we were young doesn't mean that our kids has to do that too.
Yeah, for sure. But would you say, like, what would you do with like checkups with a dentist with kids? Should it be on a yearly thing as well?
I would say the first thing is check your vitamin D3 level. That's the number one. Because if you know your vitamin D3 is high enough, there's a quite good likelihood that your teeth are quite stable. And then rule out gluten, or just leave away gluten containing grains is a big one. And then yearly checkups might be a fine strategy if you have a good just to have a look. As soon as, I would say, as soon as they get their real teeth, their adolescent teeth, it's a good strategy to go see a dentist. Before, if you see that they get tooth decay and stuff, then yes, for sure. But it's more about lifestyle.
For sure. Okay, so like two quick ones would be like grinding. What would you do about teeth grinding?
Teeth grinding is a compensation pattern. It could be a functional issue, like that is just a bite is off, but a lot of times it's due to stress in your life. Could be every epigenetical stress, could be your stress at work, could be your wrong nutrition, but oftentimes it's again related to the 3 health killers in your mouth. So especially root canals and cavitations are main cause for grinding, because your nervous system is just on fire, and at night you do this, you grind like crazy. And so functional when it comes to just biting issues, and second is it's a stress relief system.
Okay. And in regards to people who drink a lot of coffee, what do you have a strategy around that? Like in terms of like coffee having an effect on the enamel, would you be drinking water after it to like swish and throw it out a bit like what the Italians do? Like when I've been in Italy or even in Croatia, it's like espresso with some water. So
I would always probably drink way more water than coffee for sure. But obviously tannins or coffee and red wine and green tea even, it will stain your teeth even though you use water. So to really get that stain off at times, I think a dental hygienist appointment is a good strategy. Also for relieving the biofilm. You cannot really get it perfect yourself.
Do you think there's any issues with methylene blue staining your teeth as well? Or do you think it's just transient? Do you think, or do we even know there's long-term data to?
Obviously, if you have a temporary, like patients of mine, biohackers, they get a temporary and then they're like, oh no, it's now blue. And it's like, why would you do that? Methylene blue on a plastic, that doesn't make any sense. Methylene blue definitely, if you use that like we do sometimes in the mouth, will show you your biofilm, because it really gets stuck to the biofilm if you have like not healthy teeth. I personally use methylene blue more for my intestine and the gut issues. So I don't need the brain oxygenation. Therefore, I don't like it too much in the mouth. But I did it a couple of times, and you can really then see that you have a little bit of leftover of the methylene blue where you have the biofilm, which is a good indicator actually that you need a bit of a cleaning. Because the biofilm is basically oral bacteria working together in compartments now. They're building their houses on your teeth.
Yeah. So, I mean, is there any tips, hacks, easy wins that you want to share with everyone else? Anything that we might have missed or want to cover?
Easy win is always avoid the most pro-inflammatory foods if you can. Gluten-containing grains, sugar, like every dentist tells you. By that I mean refined sugar. I don't mean like carbs in general. Refined vegetable oils is also very bad for your gums especially. And conventional dairy is also a big issue here actually for your oral microbiome. I don't talk about A2 raw dairy. So this is the core four. And then eat more protein, actually. Protein and minerals. And check the vitamin D3. I already said that. Because then you already have kind of like the building blocks you need. Protein for the amino acids for the enzymes that you need to produce. Enamel and collagen for your gums. Vitamin C is critical.
Yeah. I mean, I would add
that's the easy wins.
I would add to your vitamin D testing would be highly sensitive CRP, which is basically an inflammatory protein. And again, when there's inflammation a lot in the body, that number would be high or raised. So again, that's a good number to track to see, for example, I got 5 fillings, I got 2 root canals, get a starting point with that. And then basically maybe do a bit of work there, then another year later, do a little bit of work and see the trend of that highly sensitive CRP go down as you optimize your oral health. In addition to heart rate variability. So heart rate variability, like either on an Oura Ring or using an app, these are good metrics to just look at, okay, the inflammatory process on the overall level of the body is and again, the strategies, the hacks, the things that we're doing, lifestyle, medicine, is it really working and shifting the needle?
Yes, I have a good one additional for you that you might not know yet because it's also new. In addition, there's one new marker out there.
Tell me, share it.
You will love it. It's called AMMP8. You probably heard of it. It's activated metallomatrix proteinases 8.
Yeah.
And we can now measure it in real time in the clinic. And it finally, because it's the most researched in medical world, the most researched single marker for overall chronic inflammation. And it will show you the mouth-body connection, which is unheard of. So now I can measure in your mouth within a minute, or 5 minutes to be fair. In 5 minutes, I know if your body is systemically breaking down collagen, which means you're chronically inflamed. And I can also add to this one a site-specific measurement and tell you, okay, your overall is fine, but this root canal has a super high number, or this titanium implant has a super high number, which means collagenylysis, and therefore we know, because it's very well researched, it transfers to the overall body. That's why I lately gave a speech on the Congress was called the mouth-body connection, because this is a medical marker to finally cross-link oral with systemic. Amazing. Could be done by everybody.
Can you repeat that test again?
A minus MMP8.
Yeah.
Activated metallomatrix proteinase 8, number 8. Best researched in the literature. And amazing because it's now like we can really do it in real time. And Dentognostics is doing the test. It's really, really, really good. And I'm really happy that we have that because we anyways use every test out there, even higher CRP and HRV, and we track everything. But this one is like really specific from oral to systemic. So you now finally can finally work it together. That like in functional medicine, I'm doing this for so many years. The mouth is even there, it's still not existing.
But even like I presume that your diagnosis by just looking at someone's mouth, teeth on a visual level, you can pretty much like be pretty good at it. How many mouths have you actually seen in your life? This would be actually a cool question.
You cannot even
Come on. Put a number on it. If you had to guess.
If I had a guess, at least above 5,000, more than that. More than 5,000 for sure. I've placed 5,000 ceramic implants, but it's mostly more than one in a mouth. So probably it's even 10,000. But panoramic X-rays, I have seen more than 10,000 for sure, because I diagnosed so many. And this is also in the course, because I also want that every health coach out there, I don't even care if you're a doctor or health coach or functional medicine practitioner, whatever, as long as you're interested in optimal health, I believe that all of us need to be able to diagnose a panoramic X-ray, even the patients out there. That's why it's in the course. You will learn how to diagnose your own panoramic X-ray to find the 3 health killers: root canals, cavitations, and metals. Because this is easy. First, one glance, and it doesn't make sense to go the route to give you a trillion of supplements to compensate for that. You might need to see a biological dentist at one point. But number one, start with optimizing your health the way that Ryan says it. We live it, we preach it, we practice it. It's all the same. Like we go back to nature, like more ancestral.
Yeah, definitely. So
back
again,
to nature.
Yeah, so I'll be recording this conversation. It'll be on
Oh,
IG
nice.
and it'll be on YouTube as well. And then just to add to this, there's a newsletter coming out. I think maybe it'll be released on, I'd say Thursday or Friday. And that would just go into more detail what the post talked about. And then there'll be some references there as well. So again, look out for that in your inbox if you're signed up to a newsletter. If you want to learn more and ask, maybe obviously Dom can't give out personal advice and information online. It's just obviously, and even I can't, it's not professional, it's not how we roll. But again, if there's a general question that you might have and he's got the time available, just obviously check him out, go to his page. He's a really cool guy. Like I've hung out with him several times, like a true legend, literally. He actually talks the talk and walks the walk. A dad, like a superhuman, really. But again, check him out. He's got an amazing book as well that anyone really can understand and go through. And again, be more informed than maybe their dentist. So again, find out more about Dom and his page. Check his book out. Rewatch this if need to. Send this to someone. Forward the post. Forward the newsletter. And again, thank you very much for joining us. Dom, do you have anything else to say?
No, thanks, bro. It was amazing talking to you, and I can just give it back to you, true legend too. It's always great to hang, even if it's not in real life. It still feels like it.
Well, soon
So,
I'll be in the Middle East, maybe in February or January or something. So
I'll be there in January, early January, but maybe also then. Yeah, let's meet there for sure.
100%.
And yeah, if you guys have any question, check out the Instagram, DM me, and I'll try to answer, or somebody will, and then we go from here, and we all work together to change something, right?
Yep. Thank you, everyone.
Optimal health.
Thank you. Take care.
Thanks, Ryan. Peace.